Hello, classmates. My name is Tiffany Adams. I work as a float pool nurse at Baptist South in Montgomery. I've been an RN for 10 years. The issue that I will discuss today is the prescription opioid epidemic. This is an issue that affects all of us, whether it be as a healthcare provider or family and friends of somebody who suffers from an opioid addiction. My target audience is healthcare professionals. All of us encounter issues with opioid addiction in our daily practice, some of us very frequently, just depending on our specialty area. In the United States, nearly 400,000 people died as a result of an opioid overdose between 1999 and 2017. Currently, an average of 130 Americans die each day from opioid overdoses. Drug overdose deaths caused by opioid use account for almost 70% of opioid-related fatalities currently in the United States. Americans received more than 190 million opiate prescriptions in 2017 alone. Alabama healthcare providers wrote more opioid prescriptions than any other state, which is 3 times as many as the lowest prescribing state, which is Hawaii. The 3 most commonly prescribed opiates attributed to overdose deaths include methadone, oxycodone, and hydrocodone. The opioid epidemic has far-reaching effects past those who use prescription opiates and those individuals who suffer from opioid addiction. Family, friends, healthcare providers, supportive staff, community members, and others are also affected by this issue. The opioid epidemic is not only a local health issue, but a state and national issue as well. The number of prescriptions for opioid medications has increased drastically since just before the turn of the century. Prescriptions dispensed and the sale of opioid medication has quadrupled since 1999. CDC guidelines have been provided to all primary health care providers with recommendations for improving care provided to those patients with chronic pain. 3 key recommendations are to 1, provide non-opioid therapy when possible, 2, use the lowest possible dose to achieve pain management when opiate therapy is necessary, and 3, to always be cautious and monitor closely all patients on opiate prescriptions. The implications for advanced practice nurses are much the same as for other providers. The ethical dilemma that exists between adequately treating patient pain and protecting the patient from the associated risk of addiction and misuse creates a difficult quandary for any advanced practice provider. Patient satisfaction has far-reaching effects, including reimbursement in certain healthcare settings. Patient satisfaction in regards to pain management can be difficult to navigate. Advanced practice nurses must strive to ensure patients that importance is placed on pain management while maintaining safety and attempting to limit the occurrence of opiate addiction. Medication-assisted treatment is gaining popularity with many addiction treatment providers. Medications such as methadone, buprenorphine, and naltrexone are currently used to reduce opiate cravings and withdrawal symptoms. There are also an implantable form of buprenorphine available which lasts 6 months. Vivitrol, an injectable naltrexone, blocks opiate effects for up to 4 weeks in the body. Research and development is currently underway to develop a vaccine that would cause the body to develop antibodies to bind to opiates and prevent them from reaching the brain and preventing the user from feeling the opiate high. So all of these new treatments are on the horizon and hopefully will help with this epidemic. The opioid epidemic affects many more than those who are abusing opiates and suffering from opiate addiction. The number of Americans dying each day from opioid overdose is a staggering statistic. The opioid epidemic is deadly and presents healthcare providers with unique challenges. Community, government, and healthcare interventions are needed in order to have a positive impact on this epidemic. Advanced practice nurses will face a number of hurdles in managing patient pain safely and effectively. As research continues, the hope remains that more effective solutions to pain management and addiction treatment will become available for advanced practice nurses and other providers to utilize. Thank you for your time.